Appendicitis is an inflammation of the appendix, which is a small, finger-like pouch attached to the large intestine on the lower right side of your abdomen. This tiny organ might seem insignificant, but when it gets inflamed, it can cause a world of trouble. The exact function of the appendix is still a bit of mystery, though some scientists suggest it might play a role in maintaining gut bacteria and contributing to the immune system. However, you don't need it to live a healthy life. Appendicitis is one of the most common causes of emergency abdominal surgery in the United States. It affects about 5% of the population at some point in their lives, mostly between the ages of 10 and 30. However, it can occur at any age, even in infants and elderly people. Appendicitis is slightly more common in males than in females. So, what causes appendicitis? The most common cause is a blockage inside the appendix. This blockage can be due to various factors, such as a buildup of hardened stool known as fecaliths, which are small, stone-like pieces of stool. These fecaliths can obstruct the lumen, which is the hollow part of the appendix, preventing normal drainage of the appendix. When this happens, bacteria that normally live harmlessly within the appendix can start to multiply uncontrollably. This bacterial overgrowth leads to increased pressure within the appendix, reduced blood flow, and inflammation. Sometimes the blockage is caused by swollen lymphoid follicles, which are part of the immune system and help fight infections. In response to a gastrointestinal infection, such as a viral or bacterial infection, these lymphoid follicles can swell. This swelling can obstruct the lumen of the appendix in the same way that fecaliths do. In other cases, it might be due to tumors or parasites. In all cases, when the appendix gets blocked, it creates an environment where bacteria can multiply rapidly, which leads to infection, which in turn causes the appendix to swell and fill with pus. Symptoms of appendicitis. The symptoms of appendicitis can start off quite subtly, making it tricky to diagnose initially. The first symptom is usually a pain around the belly button area, which then shifts to the lower right side of the abdomen. This pain is unique and often described as sharp and severe. It tends to get worse with movement, coughing, or even walking. Imagine a nagging pain that just won't go away and gets worse with every step you take. That's what it feels like. Along with the abdominal pain, you might experience a loss of appetite, which can be quite sudden. Nausea and vomiting often follow, and you may find yourself feeling feverish, with a low-grade fever around 99 to 100 degrees Fahrenheit. Some people also experience constipation or diarrhea. The combination of these symptoms can make you feel pretty miserable and anxious. If left untreated, appendicitis can lead to serious complications. The most concerning is a ruptured appendix. When the appendix bursts, it releases infectious materials into the abdominal cavity, leading to peritonitis. This is a severe, life-threatening infection of the abdominal lining that requires immediate medical intervention. Symptoms of peritonitis include severe abdominal pain, fever, and a rigid abdomen. It can also lead to sepsis, which is a widespread infection that can cause organ failure and death if not treated promptly. That's why proper diagnosis and treatment are vital to prevent these serious health risks. Diagnosis of appendicitis. Diagnosing appendicitis can be challenging because its symptoms overlap with other conditions, like gastrointestinal infections or urinary tract infections. When you visit the doctor, they'll start with a detailed medical history and a physical examination. During the physical exam, the doctor will check for tenderness in the lower right abdomen. They might apply gentle pressure and then quickly release it, a technique known as rebound tenderness, which can indicate irritation in the abdominal lining. To confirm the diagnosis, several tests can be done. A blood test will show if there's an elevated white blood cell count, which signals infection. A urinalysis might also be performed to rule out a urinary tract infection or kidney stones, which can cause similar pain. Imaging tests are crucial for a definitive diagnosis. An abdominal ultrasound can show if the appendix is swollen or inflamed. Sometimes a CT scan is used, providing a more detailed view of the appendix and surrounding tissues. In some cases, an MRI might be utilized, especially in pregnant women, to avoid radiation exposure. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment of appendicitis. Once appendicitis is diagnosed, it's usually considered a medical emergency because there's a risk of the appendix rupturing. If the appendix bursts, it can spread the infection throughout the abdomen, leading to a serious condition called peritonitis, which is the life-threatening condition we talked about earlier. The standard treatment for appendicitis is an appendectomy, which is the surgical removal of the appendix. There are two main types of appendectomy: open and laparoscopic. In an open appendectomy, a single larger incision is made in the lower right abdomen, and the surgeon removes the appendix. This method is typically used if the appendix has ruptured or if there's widespread infection. A laparoscopic appendectomy, on the other hand, is less invasive. The surgeon makes a few small incisions and inserts a camera and special surgical tools to remove the appendix. This method usually results in less pain and a quicker recovery. Most people can go home within a day or two after the surgery and return to their normal activities within a few weeks. In some cases, if the appendicitis is caught very early and the appendix hasn't burst, doctors might opt for an antibiotic treatment first. This approach involves administering strong antibiotics to reduce the infection and inflammation. However, even if the antibiotics are successful, an appendectomy might still be recommended later on to prevent future episodes. Recovery from an appendectomy is generally straightforward. After the surgery, you'll be monitored in the hospital for any signs of complications. Pain management is an important part of the recovery process, and you'll be given medications to control any discomfort. It's essential to follow your doctor's advice on activity levels and diet post-surgery. Gradually increasing your activity while avoiding heavy lifting or strenuous exercise helps ensure a smooth recovery. Most people can return to their usual activities within 2 to 4 weeks, but it's always best to get the green light from your doctor before resuming any intense physical activities. One potential complication after an appendectomy is an infection at the incision site. Signs of infection include redness, swelling, warmth, or discharge from the incision, as well as fever. If you notice any of these symptoms, it's crucial to contact your doctor immediately. After the surgery, living without an appendix doesn't cause any long-term health issues. As mentioned earlier, the appendix's exact function isn't entirely clear, but its removal doesn't seem to affect your ability to digest food or fight infections. However, it's always a good idea to maintain a healthy lifestyle, including a balanced diet and regular exercise to support your overall well-being. At the end, while the condition can be serious, most people recover fully with prompt medical care. But it is very important to seek medical help as soon as the symptoms arise to avoid complications. Now, we want to hear from you. Do you or someone you know have appendicitis? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.